protection and also to understand withdrawal effects and its prevention. So what are the corticosteroids? Corticosteroids are a class of steroid hormones that are produced in the adrenal cortex as well as the synthetic analogs of these hormones. So this is the typical picture, and it is basically produced from adrenal cortex. So there are two types of corticosteroids that are very important and you should know about them. First one of them is mineralocorticoids and the second one is glucocorticoids. What is the function of mineralocorticoid is that it basically regulates sodium and potassium and by reabsorption in the collecting tubules of the kidney. And what is the function of glucocorticoids? It has very important effects, like it affects on metabolism, catabolism, immune response, and others. So this is a diagram you must have seen it everywhere in physiology, in biochemistry, and other. So basically, it is the normal endogenous corticosteroids is released under the influence of CRF, which is secreted by hypothalamus. As a consequence, ACTH is released, and as a result, corticosteroid and other hormones are released. Okay, so when we talk about pharmacology, classification is very important. So again, they are divided into agonist and antagonist. In agonist, we have glucocorticoids and mineralocorticoids. When we talk about antagonist, we have receptor antagonist and synthesis inhibitor. In receptor antagonist, we have mifepristone, and also then we have mineralocorticoid antagonist as well. That includes spironolactone. When there is synthesis inhibitors as well, in which ketoconazole and other drugs are included. Okay, but in today's lecture, the focus will be agonist because antagonists can be read everywhere, like ketoconazole and spironolactone. They are covered in other topics. Okay, so what are the effects of glucocorticoids in the body? They are similar to the right now I am talking about the endogenous hormone, not the exogenous. When we talk about the endogenous hormone, so you must have covered it in physiology as well, but when we give it as an exogenous, the same response will be produced by all the corticosteroid hormones. Okay, so first of all, it will affect the carbohydrate metabolism by favoring gluconeogenesis, and it also helps in increase. It has a potential to cause protein catabolism. It is anti-anabolic hormone, and it can also cause hypoglycemia. So it has a role in stress as well. Basically, raise plasma glucose level and prepare the body to combat. And it also increase plasma fatty acid and ketone body formation by increasing lipolysis. If you have any difficulty in interpreting these things, always remember Cushing syndrome or that moon phase that you must have seen lots of time earlier. So there is increase in gluconeogenesis. There is a protein catabolism, and we all know that it has a role in stress, and it also increases plasma fatty acid and ketone body. Let's see what next it is doing. So it has a role in immune response and regulation of inflammation, and it is going to decrease lymphocyte, monocyte, eosinophils, and basophills, but it will increase neutrophil count. How is it going to increase? First of all, it can increase it directly, and also it helps in as an anti-inflammatory effect. It inhibits neutrophil movement to the inflammatory cell. So if the neutrophil will not go there, so definitely the neutrophil will be increased in the blood. So in this way, remember this thing that it is going to increase neutrophil and rest of the cells will be decreased. It can also cause the atrophy of all lymphoid tissues as well. Then it has also anti-inflammatory effects. When we talk about anti-inflammatory effects, we should remember the three things: rubor, color, and all that. So it is inhibiting all the classical signs of inflammation. How? By how? By definitely decreasing these cells' movement towards inflammation, also by decreasing certain cytokines release, and also by inhibiting prostaglandins. So all these mechanisms help in decreasing the signs of inflammation. It also decreases intestinal calcium absorption and inhibits osteoblasts. That's why corticosteroids has a potential to cause osteoporosis. And it also promotes sodium and water retention by mineralocorticoid activity. So this is a picture of therapeutic uses and effects. So let's see what it is doing. It can help in infections. It can cause infections actually because of the decreasing immunity. Okay, it can help in pain relief. It can be used as an anti-allergy drug. It has a role in immunosuppression, as an anti-inflammatory drug. It can also reduce blood vessel permeability because it is going to decrease all the things that are going to that leads to inflammation. So, okay. So when we talk about naturally occurring glucocorticoids, not that are synthesized in the lab. So this includes cortisol, is commonly known as hydrocortisone, and the normal secretion in our body is between 10 to 20 milligrams. It basically follows a circadian rhythm, that is, it rises in morning and after meals. So what happens? It bound to corticosteroid binding globulin, while synthetic ones binds to albumin. So this is a difference between naturally occurring glucocorticoids and the synthetic ones. Because the naturally occurring is going to bind with the cortico binding globulin, while synthetic ones going to bind with the albumin. The half-life is 1 hour to 1.5 hours, and it is basically metabolized by liver. So cortisol follows a circadian rhythm. Okay. Now let's talk about the synthetic or exogenous glucocorticoids. So basically they can be divided into short acting, short to medium acting, intermediate acting, long acting, and we have separated them into. The short actings includes hydrocortisone, cortisol, prednisolone, prednisone, methylprednisolone, and intermediate acting includes triamcinolone, peramethasone, and others. Then we have long acting that includes betamethasone and dexamethasone. That's why they both are given orally and sometimes IV as well, both in the both form. Mineralocorticoids include fluorocortisones and others. Okay. So let's talk about the mechanism of action. Whenever we talk about the mechanism of action of steroid, always remember the same mechanism of action is shared by thyroid hormone. All the hormones are androgens. So all the hormones that have a steroid nucleus, like vitamin D, so they share the same types of mechanism of action. Even their receptor is same. So they basically binds to steroid hormone to receptor, and then it moves inside the cell, inside the nucleus. After translocation, it is going to bind the promoter region of the gene, and by transcription, this can lead to new protein. The same mechanism is shared by thyroid, vitamin D, androgens, and many other hormones and substances that have steroid. So this is something like it's a common mechanism of action. You don't have to remember it like specifically for steroid, but just think that you can write this mechanism in thyroid as well, in androgens as well, and in vitamin D as well. Okay? So this is something that is happening. Okay, normally as well. I'm not talking about the exogenous or endogenous. Even normal endogenous steroid, whenever it is released, it is going to produce its effects in this way. Okay. So let's talk about something related to pharmacology. So which type of preparations are available? It is available as a topical steroids as well, in an inhaled form, oral form, and parenteral form. Now let's talk about the clinical uses. First of all, it can be used, we have divided the therapeutic uses into adrenal disorders and non-adrenal disorders. When we talk about adrenal disorders, it includes Addison's disease. It can be given in Addison's disease as a replacement therapy. In replacement therapy for secondary or tertiary adrenocortical insufficiency, also for the diagnosis of Cushing syndrome, and also for replacement therapy for congenital adrenal hypertension. When we see, let's see what are the non-adrenal uses of therapeutic uses of corticosteroids. First of all, like corticosteroids has multitudes of effects. Like it can affect every tissue of the body. So it has like the uses are, there is a long list of uses, and simultaneously there is a long list of side effects as well. First of all, it is going to suppress allergic, inflammatory and autoimmune disorders. Why? Because it is inhibiting and decreasing the inflammatory reactions. We have already seen it and studied it that it is going to decrease lymphocytes and basophills, monocytes, and all the WBCs of the cells of the body. Plus, it also affects the cytokine productions of the body and also have a role in prostaglandins. In this way, it has multitude of uses in allergic, inflammatory, and autoimmune disorders. It is used as a second line treatment for asthma because those patients, like patient around you who are suffering with asthma, you must have seen it. It is even in moderate asthma as well. You must have seen it that steroids are given in orally, in inhaled form as well. So like it is something very common. Then it can also be given in transplant rejection, acute transplant rejection, and graft versus host disease. In all these processes, it can be given again to decrease the immunity. Used in the treatment of heart failure, it is also used for pain relief in inflammatory condition and for therapeutic immunosuppression. Okay, so whenever we talk about, let's talk about adrenocortical insufficiency. In Addison's disease, chronic adrenocortical insufficiency, we have to give hydrocortisone and fluorocortisone because it has a mineralocorticoid action. Hydrocortisone should be given in between a dose of 20 to 30 milligrams. Then we have in acute adrenocortical insufficiency, hydrocortisone can also be given. This is a typical pictures of Addison's disease you must have studied today. Like the patient can have bronze pigmentation, distribution of fat is disturbed, there is a hyperglycemia, weight loss, GI disturbances, weakness. Plus there is decreased sodium and potassium. Okay. So be remember that mineralocorticoids has a potential to cause hypotension, hypoglycemia. The absence can cause hyponatremia and hypertension. Then the other uses are, it can be given in congenital adrenal hyperplasia. Like it's congenital thing, so fetus, we can protect the fetus by giving dexamethasone to mother during pregnancy. And in infants, like after the baby is born, we can even give oral hydrocortisone to suppress ACTH. Then in Cushing syndrome, like just only for diagnosis purpose, or for adrenalectomy or surgery of adrenal gland, then we can give. Otherwise, definitely it is prohibited. It is contraindicated. Okay. Then in Aldosteronism, it can only be given for diagnostic. Okay. So some other uses are, it can be given, we can give steroids in cancer palliative care. And dexamethasone is our drug of choice, and basically it decreases capillary bed permeability and thus decrease periodontal. Okay. Then it can be given in ulcerative colitis. Not only in ulcerative colitis, it can be given in all the autoimmune diseases like IBD, like rheumatoid arthritis, SLE and others. Okay. One of the latest oral corticosteroid is Adrenocortical, and it is used for induction of remission in active mild to moderate form of ulcerative colitis. Okay. So it can be given in rheumatoid arthritis. In rheumatoid arthritis, how dexamethasone is given can be an intra-articular injection can be given. Okay. Corticosteroids is a treatment that can be given in short. Dexamethasone is usually given. Then in asthma, we have already discussed it. In asthma, corticosteroids plays a great role. Therapy with oral prednisolone is preferable, but sometimes nebulization is equally preferable. But first of all, we just think about going to nebulize one, then we will go for oral one. Okay? So it is also important. The other uses of corticosteroids can be like in COVID, it has, you must have read it that it plays, the corticosteroid played a good role in COVID because whenever there is, it's a life, what we say, it's a life-saving drug. So in COVID, it plays a role because it is going to decrease the inflammation, so it improves the breathlessness, just like it helps in asthma. Okay. So what are the drugs that comes in corticosteroid? We have, apart from hydrocortisone, we have prednisolone. It is more potent than hydrocortisone, but it has a lesser potential to cause HPA excess suppression, that is hypothalamus pituitary excess suppression. So it is used for allergic reactions, inflammation, autoimmune diseases, and many. Then we have methylprednisolone. It is very potent and more selective. It can be given in ulcerative colitis, in non-responsive rheumatoid arthritis, renal transplant, and others. Then we have triamcinolone. It is potent and again selective glucocorticoid. It can be used as an intra-articular injection. Okay, then we have dexamethasone. Dexamethasone is potent and highly selective, long-acting drug. It can cause marked HPA suppression. And what happens when there is a marked HPA suppression? Can anybody tell me this? Okay. It can be helpful in implementing allergic reactions, shock, and cerebral edema. Then we have hydrocortisone. It has a mineralocorticoid activity. So it is a potent mineralocorticoid having some glucocorticoid activity. That's why when we were talking about the treatment of Addison disease, we have seen that hydrocortisone along with hydrocortisone can be given. And again, it can be given in congenital adrenal hyperplasia, idiopathic hyperplasia. Okay. Now let's see what are the risks and benefits of corticosteroid therapy. Corticosteroid, basically, it's a powerful drug which can quickly reduce swelling and inflammation and greatly improve symptoms, both incredible. However, there are potential consequences and side effects. So let's see what are the potential side effects. Side effects are basically the effects that it was producing, but in an exaggerated form. Steroids should not be taken for a prolonged time, and it should not be stopped at that time. So if you are taking it for a long time, so you should, the patient, or you should, being a physician, you should know what are the potential side effects it can cause, and being a student and being a patient, you should know if you are going to use a steroid, because steroid is everywhere. Steroid can be seen in all the in majority of the skin ailments you can find steroid. In asthmatic treatments you may find steroids. There are numerous uses. So you should be very cautious that which type of potential effect it can going to cause. That it increase appetite and weight gain. And let's see. So first of all, whenever you think about the side effects of steroid, always think about Cushing syndrome. So it is going to, what it is going to do, it is change the, like, first of all, it is going to cause inflammation. It is going to decrease inflammation, and it basically causes the deposition of fat in chest, face, upper back, and stomach. And because of this abnormal deposition of fat, so we call it moon face, and it can also call buffalo hump because there is an abnormal deposition here. Central obesity is there. Osteoporosis, because we have studied it earlier. We have seen that it has the potential to decrease calcium absorption, so it can lead to osteoporosis, cataracts, acne. Acne क्यों करा आएगा? Because you know steroids and androgens, they both are steroid family, corticosteroids, both have the same ring. So what is going to do? It is going to affect the hormones, the sex hormones as well. It is going to affect all the androgenous hormones. So that's why the patient is more prone to have acne. And especially if the youngsters are going to use it, they can cause acne and other hormone disorders like menstrual disorder and other. Muscle weaknesses is there, thinning of the skin is there. Infection, the patient is more susceptible to infection. Stomach ulcers that can cause fire because it is going to inhibit prostaglandin. So when we talk about the prostaglandin, it's like, if you recall that we have two types of prostaglandin. So it will decrease the normal prostaglandins as well that are not associated with infection. As a result, it can cause stomach ulcers as well. Then it can cause psychological problems such as depression, adrenal suppression. So it's a picture, you won't just remember the moon face, it is a buffalo hump, it is a hyperglycemia, it can cause diabetes, it can cause hypertension because of the mineralocorticoid, there is more attention. Okay, so how you will withdraw it? So let's see, first of all, we remember that what are the typical mineralocorticoid side effects. It can cause hypertension, hypokalemia, hypernatremia, peripheral edema, and metabolic because it is going to it acts on kidneys and stimulate the absorption of water and sodium. So whenever there is both of these are absorbed, so there is a potential to cause edema, and definitely the minerals will be disturbed. So there is whenever we talk about the mineralocorticoid side effects, always remember, whenever there is a hypernatremia, there is always a hypokalemia. So if there is very hypernatremia, so it has definitely there is more water, more edema, and there is a risk of hypertension. Okay. Now, how if a patient is taking a steroid? There are certain conditions in which the patient has to take. Like in nephrotic syndrome, I've seen the kids on oral and parenteral doses, and in asthma, you have to take it. So, and like in ulcerative colitis, in rheumatoid arthritis, there is a long list of diseases which you have to prescribe steroids. So, what you have to do, you know that steroids are dangerous and it shouldn't be continued for a prolonged time, but you cannot stop them. You are going to stop them, so you will be, or your patient will face consequences. Okay. So what you have to do, always whenever you think about steroid, always think about tapering of the dose. You can't stop it abruptly, but you are going to taper the dose gradually. Okay, they must be gradually reduced to permit the adrenal glands to resume natural cortisol production, because there is a lots of suppression of HPA axis. If that axis is suppressed, so the normal cortisol will not be produced in the body, because body को आदत नहीं है cortisol करने के लिए. It basically acts by feedback mechanism as well. So its body is not ready to produce cortisol. The normal cortisol that is important for the daily function of the body, that is not produced, and it will lead to adrenal crisis. So always taper off, and so that the adrenal gland will become ready to resume natural cortisol production. Okay, otherwise be prepared for adrenal crisis. Then we have certain corticosteroid antagonists. we divide it into receptor antagonist and others. In receptor antagonist, spironolactone is a basic drug. Can you recall from which class spironolactone belongs to? Spironolactone is basically a diuretic. So it has this, again, what is the similarity between the two? Because spironolactone has a steroid ring. So it is going to, कोई नहीं कहता कि diuretics का क्या side effects है, but spironolactone can help in hyperaldosteronism in hirsutism in women. And then we have eplenon. Can you recall again that eplenon belongs to which class? It is again a diuretic. Then we have mifepristone. Mifepristone is basically is prostaglandin, which is used as an abortifacient apart from these. Then we have corticosteroids antagonists. And when we talk about corticosteroids antagonists, we have synthesis inhibitors as well. That includes aminoglutamide, metyrapone, ketoconazole, and triazole. Ketoconazole is again very important. And can you tell me from which category ketoconazole belongs to? Ketoconazole is basically an anti-fungal drug, and it is also a corticosteroid antagonist. Okay, so it can be given in adrenal carcinoma, breast and prostate carcinoma, and HER2. So this is all about the today's lecture. So the things that are very important to remember, like corticosteroids is a very wonderful category of drugs. That's why we have labeled it as life-saving. But unfortunately, there are numerous misuses as well. For example, I will tell you, I know one of a very closest person, like I have seen it in my family as well. The people who goes to Hakim and all that, I know that natural drugs have benefits as well, and they are very beneficial. But I just want to say that misuses are everywhere. So that auntie was prescribed, like she had that Hakim gave her some corticosteroids for rheumatoid arthritis. क्या हुआ कि like within a 10 days or 15 days, her condition improves. So she gets happy that when I was taking the normal allopathic medicines, so nothing was happening. But now, as soon as I have switched to these herbal medications, my activity has improved, my pain has decreased. But you know what happens after a few days? For a couple of months, she used it. Then later we come to know that she developed diabetes just because of the corticosteroid. The drug that herbal Hakim was giving her was something that contains corticosteroids. So misuse of corticosteroids are everywhere. In gym, apart from anabolic stuff that are being given, corticosteroids are also given to gain the fat and all that. लेकिन क्या होता है कि definitely in the long run, you know, it is not a very good drug to be used. आप लोग जानते हैं, and you should be cautious. Similarly, even the weight gain potential of corticosteroids is so much that if you have seen the patients in asthma taking corticosteroids, the dose is very minimal, but still it has a potential to gain weight gain and all that. So एक और चीज what I want to say, that stress and cortisol, they both are closely linked. Whenever a patient is stressed, I'm not talking about the patient, I'm talking about us, me and you. If we get stressed, the cortisol level rises. When cortisol level rises, so there is a more deposition of fat, there is more gluconeogenesis, and there is a more protein wastage. Like the muscles will be wasted, and there is more fat and carbohydrate absorption and formation of gluconeogenesis. So that is like has a potential to cause weight. So this is all about corticosteroids. I tried to add all the important things, And I have also, I will add the quiz just after finishing it. So just go through the presentation thoroughly and read the books before attempting the quiz. And it's a very easy topic. So just acha sa pad lo because your exams is quite near. And I want you people to do your best in exam, and inshallah, you people will make us proud. So if you have any questions, I am open and you can ask. So till then, I am like, I'm not discussing anything, but I am waiting for your questions, queries if you have. Even apart from lecture, if you want to ask anything about steroids, because steroids are everywhere, so you can ask. So I think there are no queries, no questions. So I will be uploading the quiz soon. So just attempt it and return me. And for further queries, if you don't want to ask right now, and I don't know whether you are sleeping or whether you are listening or not, whatever. So if you have any queries after going through the presentation or quiz, you can inbox. In Admodo as well, plus we are available in college. So that